Thank you very much for your introduction. And good afternoon, everyone. My name is Chan, and I'm a clinician scientist at McGill, and also I'm also a physiatrist at the Montreal General Hospital. So today I'm going to talk about multimorbidity and chronic pain in the spinal cord injury. So I like to acknowledge the people who work with me in my lab and also the funding resources that support my work. So multimorbidity refers to the coexistence of two or more chronic conditions within one person, and no one condition takes a precedence over another. Multi-factors have contributed to the increase in the multimorbidity, which include aging, better medical treatment, improvement in the lifestyle, and also increase the prevalence of certain diseases in the particular patient population. And this is a study of the multimorbidity published in 2012. It was based on the patient experience survey that is conducted by the Health Quality Council of Alberta. A total of more than 5,000 adults from general population participated in this study. So the self-reported multimorbidity was assessed by the telephone interview. And the combinations of 2, 3, 4, or 5 comorbidity are listed in the table here. I highlighted the chronic pain in blue, which involved in most of the multimorbidity. The most common combination is arthritis, chronic pain. The most common combination of the 3 conditions, the chronic pain, arthritis, and depression/anxiety. The overall prevalence of the multimorbidity in this study was reported at 19% after standardized for the age and the sex. Of those with the multimorbidity, 70% were younger than 65 years old. So this is not only happened to the old folks. This study aimed to examine the association between chronic pain and the multimorbidity. This is a cross-sectional study that included more than 500,000 participants selected from the UK Biobank. The authors examined the relationship between chronic pain and the 45 self-reported long-term conditions. So this figure shows frequency of the chronic pain in each of the 45 long-term conditions in question. In 31 out of the 45 long-term conditions, more than 50% reported chronic pain. This table here shows the relationship between the chronic pain and the extent of the multimorbidity. The relative risk ratio of chronic pain across the count of the long-term condition was examined by using multinomial logistical regression. And there is 2 models here. The model 2 controlled for the age, sex, Townsend deprivation score, smoking status, alcohol intake, BMI, and the physical activity. So you can see there's a dose related. There's a dose-dependent relationship between the chronic pain and the count of the long-term conditions. There was about 36 increased risk for chronic pain in the participant with a single long-term condition. The 2 or 3 long-term conditions led to increased the risk of 88%. 4 or more long-term conditions were associated with more than 3 developing chronic pain. In this study, in the general multimorbidity, 55% of the patients reported chronic pain. And of the participants with the chronic pain, about 70% reported having 1 or more long-term comorbidity, and 36 reported have 2 or more long-term comorbidities. So the data presented in previous slides were extracted from the general population. As a physiatrist, I provide care to the patient with a spinal cord injury. When talking about the spinal cord injury, a lot of us may only think of the paraplegic patient in the wheelchair. As a matter of fact, the spinal cord injury can cause multiple conditions in addition to the impairment to the motor and the sensory functions. This slide shows some of the most common comorbidities, which include chronic pain, spasticity, autonomic dysreflexia, orthostatic hypotension, blood clot formation, coronary artery disease, respiratory insufficiency, recurrent pneumonia, neurogenic bowel and the bladder, and the sexual and reproductive dysfunction, decubitus ulcers, osteoporosis, degenerative joint disease, repetitive muscle tendon injuries. This is especially common in the upper limbs because the patient rely on the arm to do everything, such as transferring and propelling the wheelchair. Heterotopic ossification is abnormal bone formation in the soft tissues, such as the muscles and the tendon. I will talk a little bit about this condition later today. Not surprisingly, the mental health problem is very common in the spinal cord injury as well. This is a study of the prevalence of the multimorbidity in the spinal cord injury. In this study, the authors split the multimorbidity into comorbidity and the secondary health condition. The comorbidity here refers to the disease diagnosed by the physician during 1 year before. The secondary health condition is a health problem that is directly linked to the spinal cord injury and requires ongoing health care. So these two terms are generally interchangeable and are not differentiated in many other studies, but they are differentiated in this study specifically. The cross-sectional study was conducted in Finland. More than 800 participants with spinal cord injury were included. A questionnaire was used to screen 12 comorbidities and 16 secondary health conditions. So about 70% of the participants with the spinal cord injury reported at least one of the 12 comorbidities. I just show part of the most prevalent 12, the most prevalent ones in these 12 comorbidities. The two most common comorbidities diagnosed in 1 year before were hypertension and the back problem. The so-called back problem consists of degenerative spondylosis, sciatica, and other spinal disease. The prevalence of these two conditions of the spinal cord injury was actually significantly higher than that of the general population. As for the secondary health conditions that requires ongoing and active medical care, 99% of the participants report at least one. About 80% of the spinal cord injury patients reported the joint and the muscle pain, and 70% of these participants reported muscle spasm and chronic pain. Among these secondary health conditions, heterotopic ossification affected about 15% of the participants. This is another study conducted in Canada. This study evaluated the multimorbidity in the non-traumatic spinal cord injury. The non-spinal cord injury can result from spinal cord stroke, autoimmune disease, infection, and tumor resection, and so on. The data was extracted from spinal cord community survey. The multimorbidity in this survey consists of 30 conditions. There were more than 400 participants enrolled in this study. The participants were divided into two groups. The group 1 felt the needed help was not received. The group 2 felt the needed health care was received. In this study, 99% of the participants with spinal cord injury reported a multimorbidity. Among the 30 conditions, 13 were significantly more prevalent in the group 1 than in the group 2, including neuropathic pain. So one of the 13 conditions are the neuropathic pain. As you can see, the general prevalence of the neuropathic pain after spinal cord injury is over 70%. Chronic pain is not only a significant medical problem after spinal cord injury, what is more, it is a problem that has not been sufficiently managed. So the post-spinal cord injury pain consists of the nociceptive pain, neuropathic pain, and other pain and unknown pain. Under the nociceptive pain, there are musculoskeletal pain, such as arthritis and tendinopathy, visceral pain, such as myocardial infarct and bowel obstruction, and other nociceptive pain, such as migraine. Neuropathic pain, based on the pain location, is classified into at-level pain, below-level pain, and other neuropathic pain. The pathogenic mechanism of at-level and below-level neuropathic pain is poorly understood. This is a retrospective study conducted in Switzerland. It included 66 patients with a post-spinal cord injury chronic pain from a multidisciplinary pain center. The nociceptive musculoskeletal pain was reported in 58% of the participants. At-level pain was reported about 53%, and the below-level pain is 42%. Comparison was also made in this study between the incomplete and the complete spinal cord injuries. The patient with a complete spinal cord injury showed a significantly more frequent neuropathic pain, which is likely caused by the more frequent at-level pain, as the below-level pain shows a similar frequency in the complete versus incomplete spinal cord injuries. The etiology of the post-spinal cord injury is still a myth for us. There is no effective treatment, and at the same time, there's a lot of treatment options. Here, at least some of the options supported by the evidence. Under the non-pharmacological category, there are acupuncture, exercise, biofeedback, cognitive behavior therapy, and the therapies that use electrical and magnetic stimuli. These treatments show some benefit alone or in combination with other treatments. The common pharmacological treatment include gabapentin, pregabalin, amitriptyline, duloxetine. Opioids are commonly prescribed as well. But keep that in mind, these pharmacological treatments complicate the management of other comorbidities after spinal cord injury, such as orthostatic hypotension, respiratory impairment, neurogenic bowel and bladder, and bone disease, and so on. So this represents the challenge of managing pain and multimorbidity. Without understanding the mechanism, current treatment is not specific and off-target side effects avoidable. My research aims to review the pathogenic mechanism of the spinal cord injury-associated neuropathic pain by using the relevant animal models. As introduction, as I was introduced at the very beginning, my PhD work was actually on bone. So my research program at McGill started from spinal cord injury associated heterotopic ossification. As I mentioned before, this is a condition that where abnormal bone forms in the soft tissues, including the muscle, the tendon, and even the skin. It normally occurs around the big joint, such as the hips, the knees, the shoulders, and the elbow. And this abnormal bone in the muscle and the tendon can cause multiple problems, including pain, joint stiffness, compression on the nerve and the vessels, causing ischemic change, and the abnormal bone formation can also cause a skin breakdown. This is a big problem for the patient with the spinal cord injury. And I developed a novel mice model of the spinal cord injury associated with heterotopic ossification. I first performed a spinal cord transection at the T9 and the T10. At the same time, I introduced a muscle tendon injury at the quadriceps. So this is the CT scan for the mice at 1 week and 4 weeks post-operatively. Abnormal bone formation was only seen in the mice with the double injuries, which includes both spinal cord injury and the muscle tendon injuries. As you can see, the mice receiving only one injury does not have abnormal bone formation. As indicated by the arrowhead at 1 week, the shadow of the normal bone is very faint, but it's getting a lot dense at 4 weeks. Histology analysis also confirms abnormal mineralization and abnormal bone formation in the quadriceps in the double injured mice. Surprisingly, these double injured mice exhibit some autotomy behavior in the post-operative course. Most often, we found that they target on the leg that has a muscle tendon injury. As you can see that they bite the surgical wound and cause a wound dehiscence. But they also bite any body part below the level of the spinal cord injury. As shown here, this mice beat its tail, and the video showed that the mice was beating the leg without the muscle tendon injuries. So this autotomy behavior was suppressed by the buprenorphine injection. So this animal model is being characterized for the pain-related behavior in my lab in order to establish it as a new animal model of the pain secondary to the polytrauma with the spinal cord injury, which has not been reported in the current literature. In conclusion, the chronic pain is extremely common across a wide range of the long-term conditions. People with the multimorbidity are at a higher risk of having chronic pain. Multimorbidity is common in the patient with a spinal cord injury. Neuropathic pain is one of the most significant conditions that has not been sufficiently addressed. The mice model of combined spinal cord and the muscle tendon injuries represent a potential instrument for the mechanism study of a chronic pain secondary to the spinal cord injury. Thank you very much.